My name is Nika Seidman. I am a clinical fellow in family planning at University of California, San Francisco, and I'm here with Renee Heffron.
Hi, I'm Renee Heffron, an epidemiologist at the University of Washington in Seattle.
And we are here today to discuss what we know and what we don't know about the contraceptive method DEPO on women's risk of HIV acquisition. So Renee, I first just wanted to ask you about what we know to date about women's risk of getting HIV when they're on DEPO for contraception.
So what we know is that some studies have shown an increased HIV risk with the injectable contraceptive DMPA or Depo-Provera, but some studies have not. And all of the studies to date have been observational, which means that women in the studies made a choice about what method to use. And we know that when women who make choices to use contraception at all make different choices about their condom use than women who choose to use no hormonal contraception. And so that underlies all of the data so far about what puts a woman at risk for HIV infection, whether it be the injectable Depo-Provera or the differences in condom use. And it's very hard from observational data to tease apart what the driving factors are.
There have been two studies in the news recently that have had a lot of ripples. Has that kind of changed our understanding of women's risk of getting HIV when it went on DEPO, or not really?
So those studies are meta-analyses, and there have been two of them. And a meta-analysis is, it's important to understand a little bit about what it is. So a meta-analysis puts together a lot of data from other studies, which gives the analysis a lot more people in it or person time and makes them more powerful. But at the end of the day, what still is behind a meta-analysis is all of the limitations from the data that went into them. So these two different meta-analyses combine lots of the observational data that have already been published, and that gives them a very large sample size and a high amount of statistical power, but they're still fraught with the potentials for bias and limitations that were in the observational data. So they both give an estimate of HIV risk with DMPA that points to an increased amount of risk, but we still don't know if the risk is only due to the DMPA use or if it may be due to some underlying differences in condom use.
So I'm guessing from the way you answered that we aren't going to anticipate any major changes in the big organizations like the WHO and the CDC's recommendations about safety about DEPO. What do you think?
Well, the WHO did their last review in 2014, and these meta-analyses were not included in that review, and they would be in a future any future meetings that they have. But the WHO really looks at the quality of evidence as a whole. So even though we may have more observational studies that could be published, those types of studies don't really improve the overall quality of the evidence that we have. So while we may see more studies published from these observational data, we will even probably have more biologic studies that look at like tissue samples or blood levels of immune function and things like that. None of those are on their own as a whole will improve the quality of the evidence.
Are there any other studies besides biologic studies that we can anticipate in the next few years that'll help us get a better understanding of how to talk to women about their risk of HIV in DEPO?
Well, I think that what we really need to do is what we know about the evidence so far, which is this conundrum that we're in, that there are some data available that suggest risk, but we also know that there's a tremendous benefit of Depo-Provera, and women worldwide choose Depo-Provera as their first choice. Many women, that's their first choice for contraception, and so we really have to balance what these things might mean. That there might be risk, but the data are uncertain. That women need to have information and need to be given the choice and need to be informed about what we know. That pregnancy itself can be a risk for that unintended pregnancy is a risk for maternal morbidities and for HIV infection in some ways, certainly because of sexual behavior. So I think we need to think about, be able to balance all that information and provide the information to women and help them make the choice that's best for them.
Great. What do we know about ways that women prevent HIV from things like condoms to PrEP in the setting of DEPO?
So some studies have been done. We did a study with women who were part of one of the PrEP clinical trials to see if the ability of PrEP to prevent HIV infection stayed just as high and just as true if women were using DMPA. And we didn't see any difference among those women in the efficacy of PrEP for HIV prevention. So that's really good news.
That's really reassuring.
Yeah, and I think that in settings where women are at high risk for HIV and they choose DMPA, thinking about PrEP as an add-on method for them with their DMPA shots would be great.
I did have one additional question. There's been some talk in the news about an upcoming trial called ECHO to help women figure out what is the risk of HIV when on DEPO. Can you tell us a little bit more about that?
Sure. So the ECHO trial is a proposed study that would randomize women to at least 3 methods of contraception. And so it would compare women, for example, receiving a DEPO shot to women receiving a copper IUD, and follow them over time to look at their rates of HIV infection. And so it's a proposed study, and if it's able to get off the ground and get going, we would over time be able to look at rates of HIV infection, but also look at rates of pregnancy among women randomized to different methods, which really hasn't been done before, and also look at rates of method continuation. So if women are randomized to an IUD in a setting where IUDs are not very popular, would they stay on that method? And then also think about side effects from the contraceptives and whether or not any of the side effects would be related to women discontinuing. So it's a proposed trial that would be able to randomize women and would give a different set of data than all of the observational studies so far. I think the right people who have been following this field for 20 or 30 years are thinking about how to get that off the ground and how to do it in the most rigorous way possible.
Great. Well, that's really exciting. I'm glad we have something to look forward to.
Yeah.
Thanks.